Hi JD, my name's Andrea. I'm going to go over some discharge instructions with you today, okay?
Okay.
Do you have any questions today?
I do not.
Okay, so it looks like since you've been here, they have put you on 3 brand new medications, so we're just going to go over those together, kind of some things to watch out for, and things like when to call your doctor or if you have any problems, okay?
Okay.
So I printed you off a copy and highlighted some of the important things, so we'll just run through these real quick. First one, you have a new medication called metoprolol. You may also get it from the pharmacy under the brand name of Lopressor, but you'll probably end up getting it as the metoprolol, okay?
Okay.
So metoprolol is used to help improve blood flow through the arteries and the veins. It's also used to help manage blood pressure. And sometimes they use it for angina, which is, just chest pain, okay?
Okay.
With this medication, you're going to take it twice a day. You can take it with food if it causes any kind of stomach upset, but you don't have to. These can be cut in half, so if the doctor decides that the dose they have you on is too much, you can actually cut those in half, or crush them if you need to. Side effect wise, the biggest things would be any kind of dizziness, any new symptoms of depression, any new issues with like confusion or memory, and sometimes diarrhea can occur. The biggest thing, so for this, you're going to want to check your blood pressure and your heart rate before taking it in the mornings and in the evenings. And depending on what your doctor's parameters are, majority of the time, if they're using it to control heart rate, they're going to tell you anything less than 60 you're going to want to hold. Blood pressure parameter wise, usually if your top number on your blood pressure, which is your systolic, is less than 100, they're going to have you hold it anyway, but you just want to follow your provider's instructions, okay? The other thing is, do not take don't start anything new over the counter, any kind of supplements or vitamins without talking to your doctor or pharmacist first, because some of those things can intensify the side effects.
Okay.
If your heart rate continues to be below 60 on a routine basis and you're having symptoms of like feeling like you're going to pass out or having lightheadedness, you're going to want to contact your doctor as soon as possible, okay?
Okay.
Any new shortness of breath, swelling in your hands or feet, you're going to want to contact your provider as well, okay? Any questions on the metoprolol?
None.
Okay. The other medicine that they give you, brand name is called Zestril, but you'll probably get it from the pharmacy as lisinopril. So this medication is also used to help control high blood pressure. It's also used to help treat some congestive heart failure at times. This one you're going to also take first thing in the morning. It can be taken with or without food. It can be crushed, and sometimes it can be cut in half, but it depends on if it's scored or not. So if it's got a little line in it, you can cut it in half. If it doesn't, you can't cut it. The biggest thing with this one would be any like headaches, lightheadedness, any symptoms of like low blood pressure, so the lightheadedness, dizziness. The major thing with this is a lot of people develop a dry cough. So kind of like a dry, hacky cough that just kind of comes on out of a sudden and is not relieved with any kind of like cough drops or anything like that. That is something you're going to want to contact your provider for if that cough develops. Again, with this one, it's going to do the same thing as with the metoprolol. You're going to want to check your blood pressure and your heart rate before you take it, and just follow any parameters that the provider sets up for you, okay?
Okay.
Another thing to look out for with this one is if you develop any new shortness of breath, swelling in the hands or feet, or any kind of yellowish discoloration to your skin or eyes, those are things your doctor is going to want to know about as soon as possible, okay?
Okay.
Again, check your heart rate and blood pressure. Don't take it if you need to. Another thing with this one is sometimes it can have, it can cause something what we call orthostatic hypotension, meaning that when you go from a lying to a sitting or a sitting to a standing position real quickly, it can actually cause your blood pressure to drop pretty low. So when you're going from like a lying to a sitting or a sitting to a standing position, you're going to want to allow yourself just a few seconds to kind of stand still before you start walking, just to allow your blood pressure to kind of catch up with the rest of your body, okay?
Okay.
Any questions on that one?
None.
One other thing with that one is you want to avoid any potassium or salt substitutes in your diet, so don't take any like potassium supplements or any kind of salt additives. And you also want to avoid any kind of like dehydration or being overheated. Okay? Any questions on this? Okay. The last one they have for you is, brand name is called Glucophage. The generic is metformin. So this medication is used to control blood sugars, especially in type 2 diabetics. This one you're going to take twice a day if it's a non-extended release, and if it's an extended release, you're only going to take it once a day, okay?
Okay.
This one you can take with meals. It is actually recommended that you take it with meals. And if it's the extended release, they want you to take it with the evening meal, okay?
Okay.
This one is definitely one you do not want to crush or chew, or break it in half unless it's scored. The biggest thing with this would be to watch out for any kind of like low blood sugar, so any dizziness, you feel cool, but you're kind of like sweating, your skin's kind of like clammy or kind of wet feeling, any kind of like feeling like you're mentally foggy. Those are all symptoms of like a low blood sugar. So if that's the case, you're going to want to check your blood sugar and make sure that you're not having a hypoglycemic episode, okay? Or a low blood sugar. It can also cause some diarrhea or constipation. Most people have the diarrhea with it. It can cause some stomach pain. Some people have reported as well some like cold-like symptoms, but usually after a couple weeks those things start to subside and go away. Biggest thing would be is if you're having a lot of really severe drops in blood sugar, so anything below 70 on a routine basis, and you're having symptoms of a low blood sugar, that's something you're going to want to contact your doctor for, okay? They may need to adjust your dosing. Another thing with this one is it can cause a buildup of lactic acid. So with that, you're going to want to, if you start having any unexplained muscle pain, so you're hurting, you haven't done anything to, that could explain the muscle pain, you're having any kind of like trouble breathing, you feel like you're having either really fast heart rates or really slow heart rates, those are all symptoms of a buildup of lactic acid, and you're going to want to seek emergency care, or get in touch with your doctor's office as soon as possible, okay?
Okay.
Again, do not double up on any of the medications that we've talked about today. If you've missed a dose, you don't want to double up on those, especially if it's close to the next time for your dose. With all of these, you're going to want to avoid alcohol use. It can actually intensify the side effects. With the metformin, you want to avoid alcohol because it can actually cause low blood sugars, or it can actually lead to that lactic acid buildup. And make sure you check your blood sugars if your providers ordered it, or if you're having those symptoms.
Okay.
Any questions on those?
None.
All right, well, we'll get your paperwork and get you out of here, okay?
Thank you.
You're welcome.